Urogynecology is a combination of urology and gynecology. So we specialize in seeing just females with pelvic floor disorders, anything below the belt. For example, I'm an OBGYN. I completed my 4 years of training in OBGYN, and then we did an additional 3 years of specialty training in urogynecology. So we take care of all the female pelvic reconstructive surgery. So cosmetic vaginal rejuvenation kind of started in my practice because I was getting a lot of women asking me about what can I do. Ever since I've had my baby, things down below don't feel the same. My vagina feels looser, sex isn't as gratifying. And for those women, we can offer a cosmetic vaginal rejuvenation procedure whereby we're tightening up the muscles inside and outside their vagina to make their vagina tighter so that they can enhance their sexual gratification. At the same time, a lot of women will come to me and report that their external structures outside of their vagina is also uncomfortable. It may be bulky, it doesn't match. The lips of my vagina are dragging or sagging. For those women, we can also perform a cosmetic procedure where we do a vaginal labiaplasty, basically to take care of those problematic issues for women. So women who I typically see for vaginal rejuvenation are women who are in childbearing age. They've had kids, and whether it's vaginal or by C-section, oftentimes the pelvic floor muscles will start to weaken. And so the first step is I always encourage women, if you are having any issues, please feel free to discuss this with your OBGYN or your primary care physician or even a urogynecologist like me. But unfortunately, a lot of us assume that it's a normal part of aging or childbirth, and so then we don't feel comfortable talking about it. But what's nice is that there are certainly treatment options that are available. So the process is nice because it's an outpatient procedure. Downtime, depending on what they're having done, can be 3 to 4 days or up to a week. But then you're back to your normal activities soon after that, and there's very little pain involved. So this isn't a topic that we typically sit around the lunch table and talk about with our girlfriends, but it actually is pretty common. And sexual health is one of those issues that I think a lot of women are embarrassed or too shy to really talk about with their physician. So it's nice to be able to offer treatment options to women and let them know that this is something that we can address.